Hello, and thank you for attending the Interact for Health Innovation to Reduce Tobacco Disparities webinar. My name is Julian Collins, Community Outreach Officer with Interact for Health, and the one who will be going with you through this presentation. To start off with, just to give some information about who Interact for Health is, our mission is to promote health equity to improve the health of all people in our region. We cover a 20-county service area within Ohio, Indiana, and Kentucky. The ways that we go about reaching our mission is through grants, education, research, policy, and engagement. To amplify the impact of our work, Interact for Health focuses on three strategic priorities: reducing tobacco use, addressing the opioid epidemic, and school-based health centers to ensure that children have access to health care. While tobacco use in the U.S. and Greater Cincinnati area has declined over the past few decades, our region consistently lags behind. Tobacco use is still one of the leading preventable causes of illness and premature death. The progress to reduce tobacco use has not been experienced by all people, particularly among residents living with lower incomes who have disproportionately higher rates of tobacco use. By supporting policy change and innovative approaches to reduce tobacco-related disparities, Interact for Health is working to create healthier communities that protects all people from the harms of tobacco. The way that we are going about doing this is through a three-pronged approach. Under strategy 1 is our tobacco policy change, where we are looking to increase the number of people in our region covered by model tobacco policies. This includes Tobacco 21 policies and tobacco retail licensing, creating smoke-free workplaces, as well as restricting the sale of menthol and flavored tobacco products. Under strategy 2, which is innovation to reduce tobacco-related disparities, we're looking to pilot and spread promising programs and practices to reduce tobacco-related disparities. We were looking to really address the root cause of tobacco use and co-design strategies and build community capacity to tackle tobacco use. Lastly, we are doing work in marketing and community relations, implementing a marketing strategy to promote cessation and change social norms among populations with high rates of tobacco use. This is looking at using counter-tobacco industry marketing as well as traditional and non-traditional marketing tactics. Now to go into a little bit of information and background as to the areas that we chose for this RFP, we're going to be looking at our Greater Cincinnati Adult Tobacco Survey. In the survey, which was looks at data from 2017 and 2018, we saw that we are making progress, but Greater Cincinnati still lags behind the nation. Looking here at this graph at the percentage of adults who are current cigarette smokers, we can see that Greater Cincinnati has around 19% of Cincinnati's who are current cigarette smokers, where the nation has 14%. If the percentage of Greater Cincinnatians who smoked was similar to the nation, our region would have 90,000 fewer current smokers. And while we're making progress, we also have to note that the tobacco landscape is ever changing. This slide shows the percentage of people who use tobacco products and the rates in which they do. As you can see at the top, 34% of adults have used any tobacco product. So that is around 600,000 Greater Cincinnati adults. And really, that's enough to fill Great American Ballpark over 14 times. Next, we're looking at how we break that down by product. So, of the 19% of adults who are cigarette smokers, they are more likely to be between the ages of 30 and 64 years old, living with lower incomes and less education. Of e-cigarette users, those are more likely to be between the ages of 18 and 29 years old with a high school diploma or some level of college. Cigar and cigarillo users are more likely to be men between the ages of 18 and 29 years old. And lastly, smokeless tobacco, which includes dip and chew, are more likely to be men between the ages of 18 and 29 years old. So while we're making progress and we're seeing how these numbers are going down, we're not seeing that spread across the board equally amongst all populations. Tobacco-related disparities in our region can really be seen amongst some glaring areas, such as people living with lower incomes, young adults, African Americans, and people living in rural Kentucky counties. And we'll kind of discuss that a little bit here next. So firstly, let's look at smoking concentrated among people living with lower incomes. If you look at this graph, you can see those living in poverty smoke at a rate of 54%, compared to those with higher incomes who smoke at a percentage of 13%, and those living just above the poverty level smoking at a rate of 22%. That 54% is really 3 times more than those living with higher incomes. So what's behind this? In areas of people living with lower incomes, we see that the tobacco retailer density is higher. You find more places where you can buy tobacco products. You find more marketing advertisements in those neighborhoods, including billboards and ads on bus stations and stores, as well as you have point of sales discounts and different coupons mailed to customers in those areas. And there's also limited access to cessation services, such as in-person counseling or the utilization of things such as a quit line. Next, we look at e-cigarettes are addicting to young adults. Here we can see the percentage of adults who are current e-cigarette users by age. If you look to the green dot, we see that 36% of adults between the ages of 18 and 29 years old are current e-cigarette users, compared to 10% of between the ages of 30 and 45, and 4% between the ages of 46 and 64. We break that down, we can see that 91% of 18 to 29-year-old current e-cigarette users report that they usually contain some type of flavoring. And what's behind this really is that there's an ever-changing product landscape and always new technologies coming on the market. There is a lot of targeted marketing towards this age bracket, which includes using social media. And then you also have higher levels of nicotine in these products that sometimes people don't think there is any nicotine in them. Also, flavoring is also a large attraction to this population range. And currently on the market, you can have access to over 4,000 different flavors. Next, we look at menthol flavored cigarettes in the African American community. Looking at the percentage of adults who are current menthol cigarette smokers, we can see that African Americans use menthol flavored cigarettes at a higher rate compared to white people. So that is 68% for African Americans and 19% for white people. So what's behind this? We see that, especially in the African American community, there is a culture for the use of these tobacco products, especially menthol flavored tobacco products. If you look at a lot of print media as well as other advertisement towards the African American community, you do see a lot of tobacco ads, which includes menthol flavored products. It is the only remaining flavor in cigarettes currently. When all other flavors were banned in 2009, that was a flavor that the tobacco industry fought to keep, because it's not just only in this product, but it's in many products, which makes it easier to start and harder to quit because it is less harsh on your throat as you're using the product. Lastly, we'll be looking at our Kentucky communities. So if we look at the bottom here, we can see that in the bold green areas, we have higher rates of current cigarette smokers. And those include our counties in Kentucky, such as Gallatin, Carroll, Owen, Pendleton, and Bracken County at 32% compared to other counties, even in Kentucky, such as 23% in Boone, Kenton, and Campbell counties, and in Ohio suburban counties, which is 17% of Butler, Warren, and Clinton. Looking at what's behind this, we see that there's a lack of smoke-free policies in these areas. And there is a long and rich history of tobacco growing in these areas. You see a lot of people who grow their own tobacco as well as use it as a large crop in those areas. And it's also deeply rooted not just in the politics, but the economy of those areas. So while we're making progress, we can still see that tobacco really is a part of our culture. Looking here, we can see that 80% of adults think smoking is common in their community. And 58% of adults have at least one close friend who currently use tobacco. And something that can also equate to people allowing people to smoke in their homes. 49% of current smokers have children living in their household. And lastly, 32% of current smokers report high levels of stress. And of course, there could be many reasons behind that, but that is just something that we can see in the data. Nearly 7 in 10 current smokers in our region are thinking about quitting for good. And that's really great news. This is an addiction that really is hard to break. So let's support our fellow residents who are trying to quit. If that is you, think about the small steps that you can take today toward this goal. And if you or someone you know needs a little extra personalized support, we suggest you call 1-800-QUIT-NOW for free help. We learned from the survey that tobacco use continues to have a major impact on the health of our community. It's been a part of the culture of Greater Cincinnati for a very long time, which is why almost 80% of adults surveyed said that smoking is common in their community. But over half of adults also said that it's a problem in their community. This recognition is the first step in taking action to create a healthier community that protects all people from the harms of tobacco smoke. With that, now we will get into a little bit more on the RFP, which is called the Innovation to Reduce Tobacco Disparities Request for Proposals. The goal of this RFP is to pilot and spread promising programs and practices to reduce tobacco-related disparities. Historically, approaches that reduce tobacco use among adults have not used an equity lens, which has contributed to disparities. To reduce overall tobacco use and secondhand smoke exposure, intentional efforts must be developed to reduce tobacco use among groups who are most likely to use tobacco and be exposed to secondhand smoke. Those efforts may include evidence-based strategies that have previously not been used with these populations or new, innovative approaches working to reduce tobacco disparities. And looking here, we're really looking to see planning and implementation of community-led pilot projects focused on reducing tobacco disparities for adults living with lower incomes, people living in rural communities, and African American adults in our area. Looking at the eligibility criteria, to be eligible for this award, you must be a public or private nonprofit or governmental agency and provide services in at least one county of Interact for Health's 20-county service area, and that includes the counties in Indiana, Ohio, and Kentucky. Now, if you have previously applied for a grant from us in the past, you will note that our grant submission process has changed a bit. So for this proposal, we are accepting submissions no later than 5 p.m. on August 18th. And RFP information and application questions, as well as all of the documents needed for this application, will be submitted through our grant management system called Fondant, which can be found on our website on Interact for Health under Funding Opportunities. Now I will talk a little bit more about the process of this grant application. And before we get there, just kind of wanted to talk a little bit more about the grant proposal submission. When you go to the application, let me see if I can take you to the website here. Once you go to our page, I'll take you back just a little bit. On the Interact for Health page, you will go under Funding Opportunities. There, you'll go towards the bottom and you'll see the Access the Grants portal. Here, you will put in your information or start a new account. Now, it is very important to understand if you have previously applied for a grant from us and do not know if you have an account, to start off with Forgot Your Password to verify if you have an account in the system. As with this new management system, we did migrate some of those accounts over. If you do not have an account in the system, we suggest that you definitely try to create a new account. Now, if you have any questions, we suggest that you contact our Senior Grants Manager, Christine Schultz. Her email is kschultz@interactforhealth.org. So that is kschultz@interactforhealth.org. Now we'll go back to the presentation here. Or is it? Just one second. You always have to like technology that takes you a bit to get back to where you were. Almost there. There we go. So now we're going to talk a little bit about the application questions. So as you can see here, these are the application questions that are part of the project information. You will need to have a statement of the problem, opportunity, or need. Here you will be giving an overview of the community engaging in this work, including community level demographics. Provide any specific data that describe your population. Describe the inequities the population faces, as well as describe how this population will focus on reducing tobacco-related disparities or how this project will focus on reducing tobacco-related disparities for one of the populations identified in this RFP. Next, we will look at the population of focus. Here you will describe the specific population of focus for this project, including age, ethnicity, race, income, and if applicable, sexual orientation. For the number of people reached, we want to know how many people do you anticipate reaching with this project. If you're applying for a planning grant, please identify the number of people you anticipate engaging in the planning process. If you are applying for an implementation grant, please identify the number of people from the population of focus you anticipate reaching with this project. In the geographical area, this is where we would like to know about the county that you are planning to focus on. And under proposed project, that is really where you'll write a lot of your narrative there. So in the proposed project area, you'll be describing your project and follow the specific instructions based on whether your request is planning or implementation. If you are focusing on planning, we would like to know how you plan to engage and include community members from the population of focus in your planning efforts. And anticipate planning activities, which can include establishing collaborative relationships, community engagement efforts, data collection, and development of an implementation plan and budget to reduce tobacco disparities for your population of focus. If you're focusing on implementation, we would like for you to describe anticipated activities, including proposed timeline, and why you expect the community of focus to help you reach this goal. And also, you'll like to know how you expect community members from the population of focus to be involved in the planning and development of this proposed project. Especially if you're applying for implementation, we would like to know to see how the community of focus had people at the table in all aspects of the planning and development of this project. With the goals and outcomes, we would like for you to describe the difference your project seeks to make as a result of implementing key strategies and activities. Project outcomes are often not the long-term impact of your efforts, but are rather the measurable changes you hope to see as a result of this project. So that can include increasing the number of non-smokers by X%, increasing the number of quit attempts by X%, and the like. Also, too, if you're applying for planning, we would like for you to describe the goal of the project and how you know the planning process has been successful. Under implementation, the goal and proposed outcomes of the project should be realistic for your organization to collect and report data on by the end of the grant. Potential data collection methods and or the data source you will use to collect this information should be identified here. Under project duration, that just talks about the length of this project, which can be, most will be between 6 and 18 months, depending on the type of project and scope. And then also you will talk about your collaborators and capacity in your organization and other related experience. So just to give some more examples of different planning activities. So you can really be focusing on researching and information gathering, establishing relationships within the population of focus, engaging community members as part of the planning process, data collection, and finally, developing an implementation plan with budget at the end of this planning cycle. Implementation activities can really be focusing on evidence-based strategies that have not previously been used within this population of focus. Maybe there is a program or an app that has been used in other areas that has not been seen used within the population of focus that you would like to try. Or you can really be focusing on new innovative approaches that have not really been seen, but can really help inform the field on how to reduce tobacco rates. Looking at the grantee requirements, if you're awarded a grant, these are some of the things that are required. For you to attend grantee meetings and technical assistance sessions periodically. Currently, these will be held virtually. Work with Interact for Health to develop a community plan, and that is for planning grantees. And if you are an implementation grantee, to work with Interact for Health to develop an evaluation plan. And then also participate in activities as part of the overall evaluation of the initiative. We definitely want to make sure that we are getting rich data and that you are part of the process so that the story is being told correctly. And we can see how these programs and processes are working. Now to look a bit at the budgeting of this grant award. So grant funds may be used for all activities related to the proposed project, but they may not be used for things such as meals while traveling, as well as lobbying activities. To put in your information for your budget, you must download the budget request form in the online system and complete one form per year of funding requested. Next, we will look at an example of this form. So here we see the example of this budget request form. At the top, you will be putting the grant year that you are applying for. Next, the top section is any revenue that will go towards the project, including grant requests to us. This also includes any in-kind time or other funds you may have for this project. Here is where you put the amount you are applying for from us. And the bottom section is project expenses. The first column is the total project expenses, which includes from all revenue sources. The second column is the project expenses as part of the request to Interact for Health. As you can see here, the total revenue at the top should match the total expenses in the first column. And the grant request to Interact for Health should match the total expenses in the second column below. And the next page of that is the narrative section, where you are able to put a line item budget narrative explaining what the funds will be spent on. Additional information that is needed for this application process includes the lead organization's current operating budget, and if available, the annual report and audited financial statements. We will also need a list of the Board of Trustees and any disclosure forms, and that form can be downloaded in the online grant management system. From the project lead of the program, we will also need their resume or CV, and lastly, we will need a concluding statement from the executive director or CEO. As we are looking to award these grants, these are some of the criteria that we will be using. So we really want to see that you are addressing reducing tobacco disparities among one of the priority populations identified in this RFP, which again is adults living with lower incomes, those who are living in rural communities, as well as African American adults in our region. You must really detail a realistic timeline. We understand that, especially in this current ever-changing world, things have definitely changed how we do things. A lot of in-person things are no longer happening or have drastically been scaled down. So we want to make sure that in this area that you are putting a realistic timeline. And let's say that more things happen and our environment continues to change, how you're able to adapt to continue to do this project. We want to make sure that you have a clearly delineated budget with justifications for each and every line item, have the staffing and capacity to lead the proposed project, and include any matching or in-kind contributions. So any other tips or hints that could help with this project? We know tobacco is an issue. So what we really want to see is that you are specific as possible about your population and your community. We really want to make sure that we understand the landscape of the people that you're looking to work with and the community that you are looking to focus on. Avoid using any jargon or acronyms, and be realistic with your timeline and anticipated objectives. And as always, you can always reach out to us for questions. At the end of this presentation, I will have my contact information. If you have any questions or if you have an idea that you just want to run past us first before submitting, that is also fine. Here is the timeline for this RFP. This webinar is available on July 21st, 2020, and the proposal deadline is 5 p.m. on August 18th, 2020. Once those applications are in, we are going to be scheduling site visits. These will be done virtually and usually last around an hour where we are able to really ask questions and really get a better understanding of the project and what you are envisioning in your words that sometimes is not always understood in just writing. So those will be scheduled between the time of August 31st and September 4th, 2020. And in the application portal, you can choose from a variety of times available. The notification of grant award will be done on September 25th, 2020, with an online grantee meeting or workshop scheduled on October 9th from 1 to 2 p.m. to get started with this project. So lastly, this is my contact information. Feel free to email me. My email is jcollins, JCOLLINS @interactforhealth.org if you have any other questions. We look forward to reading your submissions and working with you in the future. Thank you so much.